Have you tried just about everything for fine lines, wrinkle, sun damage, and crepey skin? Today I want to show you a treatment that I will be performing on my patient that it is specifically tailored for her concerns. I want to introduce you to the CO2 laser and the cool peel. If you like video and education about anti-aging, skin rejuvenation, and aesthetics, make sure to subscribe to my channel. One of the things about CO2 laser and cool peel is you can customize specifically this to your client. There are over 20, 30, and 40 settings that you can choose and play with to get the results that your patient wants. For my patient, I'm gonna be doing an aggressive CO2 laser. We did a moderate CO2 laser about 6 months ago, and her downtime was about probably 10 to 11 days. Yes, she was swollen, specifically on the eyes area, because we were looking to tight that area of the eye because she doesn't want to go the route of surgery. Today, we're gonna be even more aggressive with this treatment. So you'll see as soon as I put the laser around her eyes, you're gonna see that skin contracting immediately. It is amazing to watch. We're also gonna do a customized setting to work on her sun damage, because that's one of the main issue that she's actually dealing with is all the years of sun damage that she have experienced. She is from Puerto Rico and she never used SPF on her life until now. So there's a lot of sun damage accumulating throughout the years. So what I'm gonna do is remove the numbing cream. We use a very strong prescription strength numbing cream. Not all numbing creams are created equal. That's why patients always had that fear, is this gonna hurt? Is this going to be very painful? And it could be 100%. Everybody pain tolerance is completely different. I know that this patient has a very high pain tolerance, so that's why we're going to be very aggressive with her laser. I know she will follow specifically instructions that I already gave her, and I'm going to give it to her again in writing so she can take that home. She also have a specific skincare routine that I want her to be using at home while she's recovering to maximize the results and to minimize complications. It's really important that you take the whole numbing cream. So I have different steps in how do I do this. I will remove with a towel or gauze, and then I'm gonna take alcohol and wipe her whole face, and then I'm gonna take hypochlorite acid, which is an antibacterial spray, and spray her face. I don't want any bacteria whatsoever on this patient's face because I'm literally doing a very aggressive laser, and if that bacteria goes into the skin, she can easily develop an infection, and we just don't want that. First, I'm going to do her face, and then I'll take this off, and then I'm gonna do the upper eyelid for that contraction that we're looking for. The thing about CO2 laser, and an aggressive one that we're going to be doing for her, is that we're working on fine lines, we're working on wrinkles, we're working on sun damage, pigmentation, but we're also working on that collagen stimulation that we all want to kind of slow down the aging process. And that's what CO2 laser will do. For her, the specific setting that I put was for pigmentation, because that's what she mainly wants to get rid of. And I also did a specific setting for around her eye to tighten that skin around her eye. She will be swollen for the next 10 to 11 days. Even the area of the eye, she might have difficulty opening the eyes for the first few days because we're working very hard on this area, but I'll give her prescription medication to kind of help during that process so it's not that uncomfortable. I just asked her what is her pain level, and she just say a 5, which I think is amazing given that we're doing a very strong laser on her. What is recommended for a aggressive CO2 laser will be about maybe once every 6 months. I wouldn't do it more sooner than that because it's very aggressive. Now, if you're doing a lighter setting, like a traditional like cool peel, you can definitely do it every 4 to 6 weeks. That shouldn't be a problem. If we're actively trying to fix acne scars, for example, I will try to get an aggressive CO2 laser if you're a candidate. Not everybody is a candidate for a traditional CO2 laser, only a cool peel. If you are African American, if you are Indian descent, and even Spanish, we have to be very careful doing a traditional laser because I can do more harm than good. That's why a consultation is extremely important. We don't book anybody for treatment like this without a consultation first because we need to assess if your skin is ready to tolerate such an aggressive treatment. The same goes with the cool peel. We will do an assessment. If you're a candidate, we can do it on the same day because it is a light setting, but for something as aggressive like this, no. See how quickly she's turning red? With a traditional cool peel, you're not going to get as red very quickly. With a CO2 laser, we're going to deeper layers of the skin. That's what makes it so powerful. So what I'm gonna do now is do around her eyes. What I like about this trimming is very quick. Like you're gonna be here maybe an hour because we like to numb you at least for 30 to 45 minutes. But the trimming itself is very quick. So this will be her settings for the eye. I'm gonna go ahead and take the glasses out. I'm gonna tell her to keep her eyes closed, and to protect the eye, I'm gonna do this and I'm just gonna put it in here so no laser energy will go to this area. I don't want to burn the little eyelashes. So I'm going to put this in here like this, and I'm going to treat around. I want you to pay attention in the contraction of the skin that's going to happen immediately with the laser. Now I'm going to change the settings one more time, and then I'm going to go very close to her eyelid so we can work on building stronger skin in this area, which is important because you don't want to have like hollow darkness on your eyes. So by getting this skin stronger with that collagen stimulation, eventually her skin is going to look like this. So you're not going to see all those fine lines once she's fully healed. So we're actually done with her treatment. The next thing I do, and I think this is extremely important after you are doing something as aggressive. So if you think about it, with Morpheus, radiofrequency, microneedling, and lasers and eye peels and all these technologies that helps your body kind of stimulate collagen and elastin production, you're technically injuring the skin, correct? So you have to give your skin nutrients to help your skin recover during this time. So I like to use exosomes or PDRN, you can use that, to kind of accelerate that healing process and to give the skin the nutrients that it needs to heal properly. This is one of the reasons that when you're gonna get a treatment done, it doesn't matter where you go. Make sure that after an aggressive treatment, they give you something to heal your skin. So by doing exosomes, I'm decreasing her healing time. My patient already has the post-procedure skincare that I want her to use. I know that because she bought it, but basically I gave her nectar from elastin, and that's gonna help her during her healing time. And I also gave her a hypochlorous acid spray, which is this, and this is an antibacterial spray that, besides helping you get hydrated, is killing bacteria at the same time. I think it is extremely important to have the proper aftercare products. If not, you're not gonna have the results that you're looking for. So this is it. She's gonna be swollen for the next 10 to 11 days. I personally follow up with my patients after they get an aggressive treatment. Usually by that same day at night, after I'm done with the rest of my patients, I will call my patient and see if they're doing okay. And then the next day, I also call them to make sure they're doing okay. I only do that with aggressive treatments like a CO2 laser. And she did well. She was not in a lot of pain. So as you can see, it's a very comfortable procedure to be done as long as you have the proper numbing cream. If you enjoy videos like this of me doing a procedure with my client and explaining that to you, go ahead to subscribe and let me know in the comments. Let's have a conversation. Let's see what procedures you want me to get done so I can do more of those for you.